Hey, Taylor with West Physiotherapy. So this is the season for respiratory viruses. We've got the flu, RSV, COVID, take your pick. There's probably some other ones, just your typical rhinovirus. And what I see, this has even come up with a couple of patients already, is when you have a lot of coughing and sneezing, then you experience a lot of increases in usually intra-abdominal pressure. And this can lead to, one, sometimes increases in back pain, especially if you have any kind of discogenic back pain, then frequent coughing and flexing can really exacerbate that. And the other is pelvic floor issues, especially leaking. So it's not uncommon at all in the clinic for me to see women come in with new onset of urinary leakage. And what they tell me is, I really wasn't having many problems. Then I was sick, I was really coughing a lot, and now I'm noticing that I'm leaking much more. So I wanted to give you a couple of tips kind of to help mitigate this in the short term. And so one is just to get in check with how you're even coughing. Ideally, when we're coughing, there's a lot of things that are happening, but you're taking a deep breath in, so you're increasing the air in your lungs. You close your glottis, it's an area in your throat. If you go to swallow, you'll feel the glottis close, it closes off the trachea, and that builds pressure. And then you cough that increased pressure out to try to, get something up. So what happens for a lot of people is they end up, that increased pressure sometimes is not very well managed going up and out. It ends up going down and out. So just to check in with how you're managing this, go ahead and place, you have a couple of options. Place one hand on your stomach, and another you could place kind of like between your sit bones, and kind of like in the area where your pelvic floor is. And try coughing. Okay, and notice, one, what happens under the hand. Does it go down and out against your hand, or does it go up and in? And then feel the bottom hand for your pelvic floor. Do you feel that area like bulging down into your hand or coming up? And so what we would like is that automatically those two areas are coming up and in. So as pressure is increasing, then the pressure is getting directed up because we're having the muscle support the abdomen, the low back, and the organs of the pelvic floor. If you're feeling the abdomen bulge or the pelvic floor bulge, then that means you're not automatically engaging those core muscles, and that cough is not as effective. And also you're getting increased pressure either on the low back or on those pelvic organs. So that's how we sometimes end up with back pain or increased kind of problems like leaking, increase in prolapse. So one thing, really quick thing that you can do is just try to intentionally draw those areas up and in when you cough. Think about coughing up and not so much flexing and coughing down. So I hope that's helpful. Sometimes it can be as simple of a fix as that, but sometimes a little more complicated for people. And if it is, feel free to reach out to me. This is something that I help people with all the time, especially women. The low pressure fitness training that I do is excellent for this, and one-on-one physical therapy can be very helpful in managing those pressures and helping you get better muscle coordination if you're struggling to solve some of these problems yourself. All right, thanks so much. Bye-bye.